Hello and welcome to my presentation. My name is Lauren and today we'll be discussing the role of the nurse regarding addressing the issue of colorectal cancer in our over 45 male community. Nurses can raise awareness of colorectal cancer in the community by supporting patients in the community health setting. This can be done by promoting the National Bowel Cancer Screening Program to patients, as the eligible age of the program has since been lowered to 45 years old to increase early stage detection of the disease. Raising awareness of colorectal cancer includes heavily involving the uptake and participation of regular screening of the disease, which is currently underutilized by the community of men over 45, which is the age the Department of Health recommends for commencement of screening. Nurses can aim to increase participation by promoting this program to the community, therefore increasing the program's uptake and increasing recognition of the disease's early onset. Promotion of this program includes providing information about the screening through brochures and discussion during visits, along with demonstration of the kit and assistance in completing the necessary forms for the process. Furthermore, nurses can utilize the Department of Health's clinical practice guidelines to refer patients with any symptoms of colorectal cancer or a family history of the disease to a doctor for further testing. Additionally, these guidelines can be used to conduct risk assessments within the community, including lifestyle risks such as diet, including red meat and alcohol consumption, smoking history, age, history of bowel disease, and family history. Utilizing risk assessments as the nurse improves the nurse's decision-making skills based on the individual's current risk, thus improving the patient's own decision-making capacity and enhances collaboration between the individual and the community nurse. Collaboration when undergoing risk assessments also improves patient adherence to lifestyle modifications and regular screening due to the education provided to the individual on the disease during the risk assessment phase. Moreover, providing education to members of the community is a key task for nurses working in all areas of the healthcare system. In the case of colorectal cancer, education can be provided to those suffering from the disease regarding self-care practices that can be implemented to improve quality of life while undergoing treatment. Empowerment through education can achieve outcomes such as an increase in management of symptoms, efficacy to cope with the psychosocial effects of the disease, and strategies to alter modifiable risk factors of the cancer. Additionally, providing education to caregivers of those living with the disease is another role of the nurse that can assist in addressing colorectal cancer within the community. Caregivers also experience high level of stress and burden when caring for someone with the disease, as it can be an emotionally taxing time witnessing a loved one experience colorectal cancer and its effects. Betkas Appenat et al. States that educational support provided to caregivers can produce a higher quality of life for both caregivers and patients due to the psychosocial support provided that empowers caregivers to understand colorectal cancer and its effects on the individual, allowing for a higher self-efficacy when managing symptoms of the disease within the community setting. Furthermore, the nurse will work collaboratively within a multidisciplinary team to provide care and address the issue of colorectal cancer. This allows for an optimal care pathway to be constructed that provides appropriate and person-centered care to individuals and their caregivers affected by the disease. The optimal care pathway has been designed in collaboration between the Victorian Government and Cancer Council Australia and maps the 7 key steps that have been developed to assist in caring for someone with cancer, and heavily involves the multidisciplinary team in coordinating care. The role of the multidisciplinary team when caring for someone with colorectal cancer is to discuss treatment options and collaborate on recommendations about one's treatment in partnership with the patient. The role of the nurse within the multidisciplinary team is to coordinate care plans and integrate other allied health professionals via referrals if needed, along with undertaking regular comprehensive assessments and managing symptoms in both the hospital and community setting. As a key member of the multidisciplinary team, nurses oversee the continuity of care provided to the individual, building rapport with the individual and their caregivers, which in turn enhances treatment compliance and promotes positive outcomes. The role of the nurse can be enhanced to be able to provide additional psychosocial support for individuals and caregivers during and after colorectal cancer treatment. As previously discussed, diagnosis of cancer in this community can lead to decreased psychosocial outcomes and an increase in being diagnosed with a mental health illness such as depression or anxiety. Nurses can provide supportive care through educational support when interacting with patients by providing informational brochures or by having an open, safe discussion about the individual's well-being. Risk assessment for mental health issues can also be utilized when caring for someone with colorectal cancer to determine their level of psychosocial well-being and their risk of developing a mental health issue. Additionally, nurses can collaborate with the multidisciplinary team to provide additional support to those experiencing psychosocial distress by referring them to psychology and counseling services as needed. Furthermore, nurses can provide education on health promotion programs that aim to address modifiable risk factors in conjunction with regular screening to reduce the risk of developing colorectal cancer within the target community. Nurses can provide information about risk factors to individuals in a safe, supportive environment using resources produced by the Australian Commission on Safety and Quality in Healthcare, which aims to address the statistic that over 50% of bowel cancer cases are caused by modifiable lifestyle factors. Aside from addressing these modifiable risk factors, nurses can also simultaneously promote the National Bowel Cancer Screening Program to aid in both early detection and prevention of the disease by empowering patients to commit to regular screening for greater health outcomes. Therefore, by enhancing the role of the nurse through psychosocial support and collaboration with the multidisciplinary team, awareness and education, the effects of colorectal cancer on males over 45 in the community can be reduced. Thank you for listening.